Good evening, ladies and gentlemen, and welcome to Muse Canada's special edition COVID-19. Tonight we have some artists that we've actually covered in our magazine as well as on our page. We have Luanne and Russ Carl from the one and only, come on, you gotta say it.
Renegade Station!
And the reason we've got them with us tonight is because they have actually been through COVID. In one case, a milder version. In the other case, not so mild. We want to get it out and show people that, you know what, yes, you do live through it, but not necessarily is it a easy road. Mm-hmm. And we're still finding things out. There's what they call long haul syndrome. And people are still suffering months later with symptoms that weren't even recognized as being COVID. Mm-hmm. So, just to get started, how's everybody doing?
We're good.
We're good now. Yeah.
We're good.
Thanks for asking.
Yeah.
And family, everybody.
Yep. Everybody's doing very well, other than not being able to see each other, which is okay. Yeah, we're doing well. We're just about 5 months in now, post-COVID. So we're here and doing okay. That's the main thing.
So you've got an idea when and where. We're not going to get into that detail because I don't know that it's that important. I think it's more important that we sort of discuss how you came about finding out you had it and then how it progressed from there. So I'm going to let you have a little chance to speak on that and then.
Sure. Yeah. So it was in July and I have allergies. I am allergic to everything. I joke when people say, what are you allergic to? And I say earth, because I really am. So I'm always sniffling and sneezing and, watery eyes and that sort of thing. But I can manage it. Like, it goes through phases, right? Depending on the weather and what's going on. And so this was early July, about the 11th. And we were heading out to go camping with our family. The first time we've been out camping in 6 years, because all our shows have been canceled due to COVID. So we actually had time. So we took a week off and we're heading down to camp with our kids. And the Saturday I was like, oh, my allergies this was the 11th of July. My allergies are bugging me. And I took some Claritin and we got to the campsite and there was lots of pollen in the trees and the wind. We were in Lethbridge. It was blowing like it blows in Lethbridge. So, my kids are like, oh, no wonder you're stuffed up, Mom, and sneezing. Like, look at all the pollen and stuff. So I felt okay. I didn't feel sick. I just felt like I was having, like, my allergies were acting up. So I took Claritin, and Sunday I got up and I still, was still really struggling with the sneezing and that sort of thing. But underlying, like, maybe I don't feel like 100%. So I said, you know what, guys? I'm just going to stay away from everybody and like, we'll keep our distance. And we were with another family that we just said, we'll sit over on this side. You guys stay over there. Don't. And then the Monday I woke up and thought, oh no, this is a cold. Like, I can tell the difference. It just, my sinuses felt really plugged up and just the difference in how I was feeling. And so, again, I said to the kids and everything, just let's stay apart. And I got some cold medicine and started taking that instead of the allergy medicine. And Tuesday morning I woke up and was like 100% worse and just had a shower, and it was all I could do to just get the energy. And we were going to Waterton that day, as we'd never been. And Russ said, maybe we should just stay home. You don't feel very good. And I said, no, I'll just stay away from everybody. I want the kids to be able to see it. Anyways, we went. I didn't go in anywhere. We were outside. I stayed away socially distanced from our kids. And if they went into a store, I stayed outside. Like I made sure, and I was getting worse, every half hour. I just was progressing. The difference between this to colds that I've had in the past is that, colds, you kind of feel crappy one day. The next day you're the worst. You feel awful. And then day 3, you're kind of like, okay, I'm okay. I don't feel great. But this was just every half hour. I was just getting weaker and worse. And Russ and our kids are grown. So Russ and the kids we were at Red Rock Canyon, and they all went in the canyon and I stayed out. And by the time they got out, I said, I can't, I need to go lay down. I need something to drink. I thought I was having low blood sugar because I was so weak. And I slept all the way home to the campsite, which was about an hour and a half, I think. And we ordered supper in. And again, I just like, I couldn't even sit up in the gravity, those zero gravity lawn chairs. I was like, this is too much. Tried to have a beer, couldn't even have a beer. So I'm sick if I don't want a Budweiser. Right? So I told the kids, you know what, I'm going to go to bed, and I'll see you guys in the morning. And so I took NyQuil and that sort of thing and just slept, and I slept for about 12 hours that night. And Wednesday, and I was up also, I should say that my gums started bleeding a couple days, like on a Sunday, which I thought, and I've had some people comment and on some of the stories that have been out, like, oh, it's gingivitis. Yes, you can have gingivitis, but not to this extreme. And I thought, like, they were pouring blood, like not just, you brush your teeth and your gums bleed. If I ate or brush my teeth, like literally, so that was getting a lot worse, like severe. And I thought, okay, that's really weird. It was kind of bugging me, so worrying me. So we went home on the Wednesday. Russ says on that Wednesday, oh, I don't think I'm feeling very good. I feel my body's aching, and I think I've caught what you have. And I kind of looked at him like, oh, great. That's when it started hitting, like, maybe this is COVID. And he and I were, we were in the same trailer camping. Obviously, we're not socially distanced. Still not, yeah. So the Wednesday we got home, and I basically went to bed again. And then that night, I woke up with the chest pains. And that's when I thought, oh, we also called HealthLink and booked a test as soon as we got home, because we thought, let's just put our mind at ease. I'm sure it's not COVID. Let's just book the test, and then everyone can relax. And I woke up that night with the chest pains, like sitting up in bed, and extremely terrifying. And yeah, that's when I kind of freaked out, like, oh my God, this is COVID. And well, it's scary, as you know, and the thought of what could happen. And when you're at that stage and you're not sure what route you're going to take, if you're going to have mild symptoms or if you're going to have severe symptoms. And so it was very scary. I do have asthma, and I want to clarify that I don't have severe asthma. I have very mild asthma. I do have a Ventolin that I carry with me for those just in case moments, more of a precaution. Because I've seen a lot of people comment about having pre-existing conditions, and that is true. And yes, my case could have been worse because of it, but I don't plan on dying from asthma. It's something that I manage very, very well. I don't take medication other than my Ventolin that I have if needed. So I did have that. So I was able to, when I started having trouble breathing, I could take my Ventolin spray, and that helped me. And I thank God that I had it. So, and then every day it just kept getting worse. And by the Saturday, so we're 7 days in now, that was the day that I couldn't even walk. I had to get Russ to help. I had gotten up and made it to the couch, and then I couldn't walk. I needed his help to do everything. And eating was, like, I didn't want to eat anything. I had every symptom. And then the bleeding gums was a new one. I had the chest pains. I had the shortness of breath. I had sneezing. The only thing I didn't have was a sore throat.
Yeah, neither did I.
And he did not either. So they say day 7 you do get worse, and I did. And there's a lot of crying and a lot of sleeping. I was taking pain medicine every 4 hours because if I didn't, I couldn't handle the pain. And then that would make me nauseous. So I take Gravol to counteract the nausea. And it was scary. And it was very scary for Russ. And so it progressed through Sunday, Monday, and Tuesday morning. So we're 10 days in. I woke up, and in the night, like 2 nights before that, I'd been up being sick in the middle of the night, and hot, like absolute sweating to the bed is soaked and then freezing cold. And but I woke up the Tuesday morning and I couldn't close my mouth, and my mouth was so sore, and I literally just couldn't close my mouth. And I had gotten up, and then I came back into the bedroom, and my gums were bleeding so bad that like I was swallowing blood. It was a lot of...
It was literally pouring out of her mouth. Literally pouring out of her mouth. That's when we decided we're going to the hospital.
I said...
We need to get this checked, see what's going on. Get there. They didn't say that she had COVID because the test hadn't come in yet. But they treated her as a COVID patient, so they gave her meds for that, and she had pneumonia on top of
Well,
that.
they treated me like I had pneumonia.
Yeah.
We had the COVID test on a Monday. Sorry, we didn't the day before, but we didn't have the test back yet.
Yeah. It's, yeah.
So
Not great.
was that the bleeding gums and that, was that a symptom that the doctors had seen previously?
No. And when I talked to Alberta Health Services, so another 10 days later, because we were quarantined for 2.5 weeks. And, they said, we don't know if that's due to the COVID, but we're going to add it. We're going to, we want that information in case more people do. And I have seen some articles written on it now about the more severe cases. So they didn't keep me in the hospital that day. They did listen to my lungs and said I had pneumonia. So it gave me antibiotics and prednisone, and to go home and monitor my breathing if anything changed. They were very clear, like if it gets at all worse, you call 911 or you get right back to the hospital. And then I basically just stayed in bed, and Thursday that week, the 23rd of July, we found out that yes, we had tested positive, and my symptoms started on the 11th.
It's unreal. Now, during this time, now I know you had definitely had a not really severe, because you were actually able to, without a little bit of intervention at the hospital, but
Yeah.
you also had it. And
Russ?
what was it? Yeah. What was it like for yourself?
For myself, I started out with the headache, the body ache, the sweats. Then my sinuses got going, got nauseous. That lasted about 2 days, like, yeah, maybe 2 days. And then I progressively got better.
Yeah, you were
And the only underlying problem I had was I lost my taste and smell. And I had lost that for about 3 months.
So, and there's a real important part to that, because a lot of people seem to think that, oh, you got the bad virus, he got the good virus, and that's,
Yeah.
and I think, people need to see that, what each person it handles differently.
Mhm.
Absolutely, yes.
It's not necessarily because you had asthma or that sort of thing. It could have been vice versa. Could have been Russ that got it worse, and you walked away, and
Yeah.
a little sniffle, and away you went.
And imagine if we both felt like Russ, and only didn't feel good for a couple of days and went back to work and was spreading it around. So as bad as it was for me, I still lived, obviously, but who we could have passed it on to. And as sick as I was, somewhat, when we were told we were positive, I just broke down, because the fear of our kids getting it, our grandchild getting it, like it was, and I mean, we've kept our bubble very, very small since March. We have a couple of, obviously, the band, but we didn't see each other for almost 3 months, I think. Yeah. Everything we did was virtually. And then even when we did get together, we made sure we were distanced, so we kept our bubble very small. A couple friends and our family, and it was devastating. And to have to call them, I was embarrassed. But just so grateful that we didn't pass it on to anyone. And Alberta Health Services kept saying that, like, thank you guys so much for making that decision right off the bat, before you had, like, even when we were camping and I started not feeling good, we said, you know what, let's, like.
Well, I mean, even if it was a common cold or flu, you don't want to pass that on to anybody either, right?
That's right.
So
when it's something you could die from, I don't understand the resistance to it,
Well, and there was something you said in one of the other interviews, Russ, and that was with regards to you standing by once you'd gotten over it, and you having, and don't take this the wrong way, you having to care for Luanne, and
Totally.
But you turned around and you made a statement on one of the interviews that it scared, and I'm going to use the exact words, it scared the hell out of you.
It did.
For your own health. But that.
Yeah.
What else was going through your head?
I was deathly afraid of losing her. I didn't really care about me. You don't really think that way. You don't think I never even thought the iota of my health and my question. It was her, always her. Of if it got worse, then what do I do? How do I deal with that? How do I
You're making him tear up, Ron.
I did my job.
Yeah, he was very scared. Yeah.
And that's something that people need to understand too, is it's not just the disease. There's other effects throughout the family, throughout the community, even in some cases. Unfortunately, we've seen probably a significant increase in people that we're all associated with that have either come down with mild versions of it, in some cases very severe versions. I'm not going to mention names just because, but I know one that's been in and out of hospital a couple of times, and ICU.
Yeah,
So,
we have someone in our music community in Alberta, in Edmonton. His wife is intubated and not, and we read his updates, and for him to be at home, and like that was my fear. Like I had a full-on panic attack because I said, I can't go to the hospital. I can't be alone. I can't be on a ventilator. Like I was so scared. People, it's scary. And when you can't breathe and you are struggling to get air, I mean, that's what keeps you alive, right? Like it's so, yeah, there's lots of things we could die from. Absolutely. I get in my car every day. Well, actually, I don't. I rarely leave the house, actually. My car actually had cobwebs in it this summer. I got in and I'm like, oh my God, I need to leave the house more. But I also wear a seatbelt when I drive, and I do the speed limit, and I follow the rules to keep me safe. I look at it the very same way. And, you know, we've had some pretty rough comments since we've told our story, which, I mean, it comes with the territory, but I'm not going to lie, I was a little taken aback when it went national, and I just wasn't expecting it. 98% though are positive comments and feedbacks, and just thanking us for sharing our story. But yeah, some pretty incredible comments of not believing us, or one comment was, we're probably not even real people. Probably just, I don't know what we are, but.
well,
They're out of a book.
Yeah.
I can tell everybody out there that, believe me, they are real. I've known them for a number of years.
Yes, you have.
You know, we've spent a number of nights together, me shooting
Absolutely.
and that sort of thing. And when I saw this, I was heartbroken too. One, because I know there's multiple exits on with COVID, and I didn't want the one I had already seen.
Right.
You know, I told you before the show, my uncle passed from COVID, and so this was near and dear to my heart, of course. But at the same time, I think we need to get this message out there. Today we saw 1,763 more people.
Yeah.
Almost 6,000 people in 3 days affected. And this is a message we need to get out to show people that, you lived through it. 90, and I don't even think the numbers are as high as what the numbers we're seeing. I think it's probably more closer to 90% than it is to 99%. I think we've missed a few over the last 9 months. I'm not going to say, you know, our system's perfect. I'm sure there's been a couple positives that were
right.
But at the same time, when we're coming up on, you know, almost 60,000 people, if there was one message, and it can be a couple things in that one message, just one message that you can get out to people about going forward and what needs to be done, what would it be?
Think of the other person. Think of what could happen to them just by wearing a mask. It's not, there's first responders out there. There is people on the front lines that wear them pretty much 24/7. And you don't hear them complaining because they know. Doctors and nurses and paramedics and EMTs, they wear them every day because that's their life. They don't complain because they know what they do. So think of the other person before you go out there, and you may not feel like it's going to happen to you.
We didn't think it would happen to us.
I never thought it would happen to us. Just Always think of the other person. That's what I say.
Yeah, I think, you know, my message and our message and why we wanted to tell our story is because we heard so many people say, do you even know anybody that has COVID? Yes, you do know people, and people are afraid to come out because of the backlash that we've been given. Whatever, we can take it, mostly. I take it a little less okay than he does, but and that's why you're afraid to come out and tell your story because of the backlash and the hatred that you're getting. People, we're just looking out for our fellow human beings. But how is that hindering your rights? Or how is the government doing this to me? How did the government make me sick? It's here. No matter how it got here, no matter why it's here, it is here, and people are dying from it. It is contagious. Simple measures can help stop the spread. Simple measures. And that's all we're saying is just think of someone less vulnerable than yourself. The person with cancer, the person with heart disease, or whatever. You don't know. There are healthy people dying from COVID. I don't plan on dying from asthma. But if I died from it, people would have said, oh, well, she had asthma. So what? Just care for your fellow human beings. Simple measures. That's a big one.
Yeah.
Well, I gotta tell you that 2 words is probably going to be the way I have the front of the promo for it, and because I think that gets it all right across. It's simple. It's not hard.
Yeah.
You know, the other thing I think I want to add, just so everybody's aware, and wear your masks properly. Putting it on your face doesn't necessarily mean you're doing anyone any good, because if it's not over your nose, or if it's not properly tightened a little bit, you know, it doesn't have to be sucking back
Right.
your nose,
No.
bending your nose or anything like that, but
Yeah.
do it properly. I've seen them, you know, I get my 2 hours out
Wearing a
for good
strap.
behavior. Yeah, I get my 2 hours out for good behavior a week, and that's grocery shopping. And I just can't believe how many people I see walking around with it down around their chin, or, you know, I'm wearing my mask because honestly, even the message on the sign says you have to wear a face mask.
Yeah.
How?
Not
Right?
how, yeah. Just wear it.
So you know, I think that's the other message I think we need to get out there. But, you know, I really want to thank you.
Thank you.
Yeah.
Much appreciated. And if even one person gets the message, we've done our job. And
Absolutely.
I'm looking forward to seeing you guys again on stage.
Yes.
It's been a while.
It has been a while. We hope 2021 is a lot better for social gatherings in the music industry, and getting together and sharing some live music and having a good time.
Well, I'm hoping we don't have to wait till London to do it. I'm hoping we get the opportunity, and we'll see you either at Cook County in Edmonton or somewhere around that. And but keep it up. Just for everybody's knowledge, you can go check them out. Renegade Station on Facebook. You can see what they're up to, and you know they might fill you in, and you know Russ and Lou might give you some cooking tips. Who knows?
Yeah, there you go.
But I definitely want to thank you guys. It's very important that we get this message out there, and hopefully we'll be out of this very shortly, and the 3 or 4 vaccines that are on their way make it through the final stages, and get everybody back up and running.
Absolutely.
Thanks a lot. And you guys have a good night.
You too.
Shall talk to you all later.
You betcha. Take care, man.
All right.